All right, so I just drank 2 pots of coffee to try to keep up the momentum from that. Thank you, Charlie. All right, so I'm gonna dive back into healthcare. We had a lot of healthcare speakers yesterday, and we've got another great speaker today.
Jerry, kill me. Kill me now, I'm begging you.
Well, what, kind of like this?
What are you doing?
Jerry!
Elaine, what are you doing here?
I like Seinfeld. By the way, I was watching Ellen the other day, and Jerry hinted that they may be coming back out with the remake. I'm excited about that. All right, so anyhow, small video clips are fun. Healthcare 2018, what's changing? Where's the category as a whole migrating to? Lynn talked a lot about the home service category yesterday in a direct-to-consumer marketing approach and how that industry has always been so powerful to take a lead and push it from a need in a household, direct-to-consumer, and then consumer response. Healthcare is going through that exact same revolution right now. So let's just talk a little bit about the numbers. You heard a little bit from Dr. Dan yesterday from Physical. Healthcare GDP growth, let's just take a look from just the last 2 years. Roughly 17% of all dollars spent in 2016 was healthcare related, 20% in 2017. You're not going to see this trend change. That's 1 out of every $5 spent associated to healthcare. I think it's a category we should probably focus on a little bit. All right, so you've heard this yesterday as well. CVS, purchased by Aetna. What's that mean? Consolidation, right? You heard this. Amazon, JP Morgan, Berkshire, disrupting the entire industry as we know it. So what's happening? Why are they doing this? If you look at the previous model of where a lead came from in the healthcare industry, it primarily started with you'd go see your primary care physician. They'd tell you what's going on. When you had a problem, they would send you to a preferred provider, right? Now, how does it work? Well, there's a couple ways. There's still the traditional silo approach, I like to call it. And then there's this direct-to-consumer approach. And this is rather new. A lot of your doctors locally don't get it, maybe don't want to get it. There's different ways that we can bring a lead or a new patient through marketing. And the reason it's so necessary right now and why you're seeing these acquisitions, these consolidations by the major healthcare providers across the country, costs are going up substantially. So then what happens to those single points? How do they survive? If they haven't already been acquired, if they haven't decided to jump into one of the main hospital silo systems, they don't want to. They're entrepreneurs. They're business owners. They need your help. If 85% of their lead sourcing right now comes from a medical referral, and these silos are getting bigger and bigger, where are they going to get their leads? What happens when those dry up? Let's transition on that one. All right, so I like to call this the pharma factor. Give you kind of a background on how this all works and why we need to share this with our providers. So right around 1997 or so, there was a big transition and change to pharmaceutical advertising. And we're still one of the only countries in the world that allows pharmaceutical advertising, by the way. What happened? Why do they do it? And why are they now one of the biggest spenders in the United States? It works. Knee pain, take this. Back pain, take this. Can't perform, take this. Right? There's always a way to take this approach and push a symptom to a solution and then go ask your doctor. So look at your providers, use these analogies, and share that exact same approach with them. what can they learn from the pharmaceutical industry to get direct source leads into their practice? I'm going to share some creatives with you to get you to think a little bit outside of the box as far as what is a symptom. Okay? There's a lot of symptoms that may not necessarily be medical related that you can provide inside of your creative, inside of your messaging. Oftentimes those barriers are simple: cost and time. Insurance is a barrier. Financing is a barrier. Now factors. What makes a person motivated? Why should they do it now? When you take control of the lead, now you're not sitting and waiting. All right, so I'm going to run you through, let's watch this creative quick, and then we can give you some results. This client actually just started in January out of the Fort Smith market.
Do your legs often ache, feel heavy, or get cramps? If you have bulging veins, leg swelling, or restless legs, any one of these symptoms can be from vein disease and can lead to more complications or problems. At Ozark Regional Vein Center, we use a nearly pain-free laser treatment that allows you to return to work or play with no downtime and no discomfort. Your treatment is covered by Medicare and most health insurance providers. Don't wait. Call now to schedule your free vein screening or visit ozarkregionalveincenter.com to get your life back.
All right, so an interesting combination there, and there's a few points that you need to pick up in that creative. No downtime, get back to the office, covered by Medicare. So the symptoms is veins. But the response, I talked to the marketing director at the clinic just a few weeks ago via email, and he said, when our spot runs, we have Medicare calls instantly. And they've been advertising on radio and television through the years and have just never really seen results. He said it's really interesting when we put that Medicare message into this creative, how much response we got back. So now they've already expanded, Whitney. This client has expanded just within the last month, doubled down on some of their targeted digital efforts with free vein screening. And the neat thing about the business model as a whole is they have a medical practice as well as an aesthetic practice in the same building. So if we just bring in a lead, they can convert one way or another. And it's been very successful for them. All right, let's take a look at this one.
Have you put off seeing an allergist because of how long it takes to be treated? You know you need help, but who has that kind of time? At Allergy and Asthma Consultants, we can jumpstart your allergy treatment with day one rapid immunotherapy. It shortens the treatment process, so you can feel much better, faster.
When it comes to the very best in allergy care in St. Louis, remember, Allergy and Asthma Consultants. We typically see and treat our patients the same day. Make your appointment now and start breathing easier.
So again, notice the symptom here. The symptom is not allergies, it's allergy treatment. Does anyone have allergies? Do you skip your treatments because you don't have the time? That's the condition. So when we change the messaging and went after the time aspect, they see better response. So make sure you're sharing some different ideas that have to do with the resistance of getting those leads. Right? So when we're targeting mom and she's running 4 or 5 kids around to practices and activities, you think she has time to go take care of that, especially for herself? Nope. But if we can change that in the messaging, we see strong results. I'm going to show you one more here out of Denver.
Chronic low back pain is a huge problem. And regrettably, it's also a problem that gets huge surgeries. You can avoid all of that surgery by getting a precise injection of your own platelets or stem cells into those damaged areas. And that's a lot less invasive than getting huge hardware implanted. Please don't let anyone perform surgery on your neck or your back before you explore all of your options.
Here we go again, avoiding surgeries. So in this particular message approach, we're not necessarily just pushing STEM. What we're trying to prove is here's an alternative to that long recovery surgery. Utilizing broadcast, utilizing OTT and some targeting platforms. and they're getting great results. Actually, I believe the email I got from the AE on this account was, "We're cooking with butter." I hadn't heard that one before. That was fun. All right, so what do you need to do? What are the categories? Go back to your marketplace. Get outside of the hospital silo. If you got your big main hospital systems, most markets have 3, 5, 7 major hospital facilities. Get outside of those main facilities and go to the private practices. When you go to private practices, look at the specialists. Average ticket is higher. They make more money on a direct conversion. Talk to them. Share some of the strategies that you're learning over the last few days here. Talk to them about a direct lead. And you can control the time process. Talk to one of your ESA consultants to get some creative examples. What's working in each industry? We have a lot of them. Let's update on specialized healthcare. All right, so I'm going to introduce our next speaker. I got a chance to meet